Hello and good afternoon. I call this October 16, 2025 hybrid meeting of the Local Government Coordinating Council to order. Commissioner Benson is excused. City Councilor Champagne, City Councilor Grout, and City Councilor Rogers are joining remotely. So I'd like to ask us to all please join me in a silent invocation, followed by the Pledge of Allegiance, led by myself. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. Thanks for folks joining us in person and online. We will start off right away with public comment. Javier, do we have folks signed up for public comment? And please call the first name.
We have no public comment today.
Thank you, Mr. Javier. Okay, we'll move on to item number 4, new business. We'll first start with an opioid settlement update by Dr. Wayne Lindstrom and John Lancelot to present. Thank you. Oh, whoops. I'll go back to that.
Thank you, Madam Chair, members of the LGCC. We've been talking since last time this year almost about the opioid settlement funds and the strategic plan with vital strategies and the agreement between the city and the county. And then we had the LGCC work group or subcommittee, and we met till I think sometime in January and came up with the LGCC guidance document. And then that went to City Council, was adopted, and then went to the County Commission, was adopted. And so we're committed to providing you with quarterly reports. And there were a number of expectations that in our implementation have been working quite diligently on. And we also had last year the passage of the Behavioral Health Authority Ordinance, and that created 3 new advisory bodies. One of those was the Behavioral Health Advisory Board, which is appointed by the County Commission. And we have convened now for probably almost a year. And I want to introduce you to our chair, Holly Mell. She's with Disability Rights, and Joseph Shaw, who's with Fathers Building Futures, if I have that correct. And so with it, they're going to be doing this presentation, and I'll be here to back them up relative to any Q&A you might have following the presentation. So with that, Holly and Joseph.
Thank you, Dr. Lindstrom. And thank you for giving us the opportunity to speak today, Madam Vice Chair. Today, we're going to be presenting our updates to the Opioid Settlement Fund projects and allocations. And then we're also going to have an update on the performance measures that we should expect from Albuquerque Public Schools, the City of Albuquerque, and then also some updates on the Public Accountability Dashboard development process. Okay, so this first slide has an overview of our current opioid funding as of last month, the latest numbers. We've received $25.5 million in one-time opioid settlement funding to the county. Just as a note, that's separate from the funding that went to the City of Albuquerque. They receive and track their funding separately from the county. Overall, the county has spent approximately $1.8 million on the projects listed in the table. We've also allocated $16.8 million in upcoming RFPs and committed funds to Albuquerque Public Schools. So that leaves $6.5 million in unencumbered funds. These are all one-time funds, which will be exhausted from the opioid settlement fund by 2028. On March 4th, 2025, the Local Government Coordinating Commission approved the opioid settlement implementation plan. And then on April 22nd, 2025, the Bernalillo County Commission approved AR 2025-37, which allocates 60% of the opioid settlement funds to intervention and treatment and 40% of the fund to prevention and community revitalization. The joint resolutions provide a total of $4 million to build capacity and sustainability for small and medium providers, $10 million for one-time shovel-ready infrastructure grants, and a total of $4.8 million for APS Crossroads program and related APS prevention and intervention programs. The funding process will be phased, allowing us to take immediate action on those shovel-ready projects, which would address urgent community needs while building long-term sustainability for treatment centers and community hubs going forward. So speaking, oh, go ahead.
Excuse me, I just want to make a clarification because there's some apples and oranges getting mixed up here. The 4 million capacity and sustainability is indeed 4 million, but it's 2 million on the county side and 2 million on the city side. With regards to the 10 million in infrastructure, that's 10 million on the county side and 10 million on the city side for a total of $20 million. Wow. And the funds for APS are a total of 9.6 million, which are split between the city and the county. So I wanted to offer that clarification. Thank you.
So the little table, the opioid settlement fund progress reports, just lets you know where we are right now with both the small and medium provider capacity. As of July, the requests for proposals were still open and then closed September 7th. There were a total of 21 proposals submitted, and there are still some in review as far as I understand it. The intergovernmental agreement for APS's prevention and intervention services has been executed as of August. And then provider infrastructure related projects, the city and the county are going to jointly review those. October 12th is when the request for proposals open, and then on the 20th, the request for proposals will be closed.
Madam Chair, may I interrupt just for 1 second? Thank you, and Dr. Lindstrom, thanks for the correction on this. I wonder if you all could put a footnote or correct those, because those are really different reporting on this slide, which I think this slide for any of the LGCC members who are not here today would be confusing otherwise. So if this report could be annotated as you just described it and sent back to the membership, I would, for one, really appreciate it.
Madam Chair and Commissioner Baca, done.
Thank you. So now I'm going to give a little update about the public accountability dashboard. The dashboard is designed to measure, there's two groups that we're designing to measure on the dashboard to provide public accountability for these funds. The first is financial measures, including details on appropriations, receipts, and expenditures. And the second is accountability measures. The accountability measures will be aligned with the behavioral health result measures, which Bernalillo County currently uses with its Behavioral Health Authority Division programs and contracts. These result measures enable us to answer 3 key questions about our funded programs. First is, how much are we doing? Second is, how well are we doing it? And third, and most importantly, is, are we making a difference? We will align these questions to the 2 categories we plan to fund: opioid intervention and treatment client outcomes, and opioid prevention and community revitalization client outcomes. After that step, Bernalillo County IT has installed a new online public dashboard platform called Tableau. Tableau will enable us to publish our accountability dashboard across the public websites for the City of Albuquerque, Albuquerque Public Schools, and Bernalillo County. Sharing one dashboard across all three organizations will enable us to better collaborate and measure outcomes using a single unified lens, and will hopefully be helpful to answer questions like you just addressed. The launching of the complete public dashboard will be a process that depends on multiple steps. As we execute contracts, we'll provide transparency on funds spent with a dashboard focused on the financial accountability measures I mentioned on the previous slide. And then second, we'll start collecting data from our contractors in a format that allows us to publicly report on these measures. And then as we receive preliminary data, we can start designing the public accountability dashboard with stakeholders across the city, county, and Albuquerque public schools. Finally, once we have a product ready for the public,
Madam Chair,
publish...
apologies, this is Julie. Javier, I believe we've lost, you're muted on the Zoom, so we can't hear the room.
Can you hear us now?
Yes, thank you.
Thank you.
I don't know if I should go back. How long did they not hear? Do you need me to go back?
No, I think you'd have to go back to the beginning, so.
Oh.
Well, this is Councilor Rogers. We heard most of it just ended at.
Like 30 seconds ago.
Yeah.
Okay. All right. So I'll do another quick run through of what's on this slide, which is just the steps that we're going to go through to launch this dashboard. As we're executing the contracts, we'll be providing transparency on funds spent with focusing on the financial accountability measures that I previously talked about on the last slide. And then second, we're going to start collecting data from those contractors in a format that allows us to publicly report on these measures. And then as we receive preliminary data, we can start designing the public accountability dashboard with stakeholders across the city, county, and Albuquerque public schools. And then finally, once we have a product that's ready for the public, we'll publish the dashboard on our respective websites. And now I can stand for questions.
Thank you so much. I'm going to open up to my colleagues, online or in person. Questions, comments? Yes, Commissioner Olivas.
Thank you, Madam Chair. Thank you for this information. One thing on the dashboard piece, I don't know that I heard an exact date. You probably don't want to pin that down, but what's the expected timeline?
Madam Chair, Commissioner Olivas, for the financial measures, we will have that particular portion of the dashboard available in the month of December. In the interim, we just created the capability to put our progress reports on burnco.gov. If the school board and the city decide to do likewise, they certainly can do that. But we purposely acquired Tableau so that we could build a publicly facing dashboard on behalf of the county. And since we're already making these investments, et cetera, and we want consistency between our partners, we're making this technology available to our other government partners on this initiative. We expect all the other performance measures related to this publicly facing dashboard to be available before the end of the fiscal year. And I know that sounds terribly late, but the reality is that we haven't even awarded all the contracts yet. And we've got to be able then to begin getting them reporting on their performance metrics and us collecting, analyzing, and then being able to report. So we'll be able to do that earlier on the financial measures, but on the other performance measures, just because of the timelines relative to procurements, contract awards, et cetera, hence the delay.
Madam Chair, if I may, one
Yes.
more question. You know, when we initially started this this dialogue about how to kind of collaborate and create this effort, you know, having that combined dashboard was really important to all of us, and I think you're executing that as well as you could within the timelines. In the interim, I guess my question is, the data that you presented today really only includes the county side, which is totally what I would expect. Are we, and maybe I can just look at the agenda, maybe I'm wrong, but are we gonna hear about what our other partner is doing with their funds and where they're at?
Madam Chair, Commissioner Olivas, I think that if you requested that, I'm sure our other partners would respond accordingly.
Thank you. Thank you, Madam Chair.
Thank you. Yes, I see Councilor Rogers' hand up.
Thank you, Madam Chair. I just had a question about the financial instruments. Is there a way to include amount left? So we have the expended, we have the, you know, what's awarded, what they've spent, but a running total of funding that has not been used. Because for me, that will help me as I'm watching for accountability to make sure that the folks we're awarding are actually spending down their money.
Well, go ahead.
Madam Chair, members of the LGCC, we're certainly open to changing the format for that. If you notice, we don't have line item numbers on this, but we do have 6.8 million listed there that's unexpended or uncommitted, because the reality is that we still have procurements out there and haven't received proposals yet, particularly around the 20 million in infrastructure dollars.
Thank you, Madam Chair. Thank you, Dr. Lindstrom. I mean, on the public-facing dashboard, you had on the slide the different things that you would show, just a running total at the end. And I've used Tableau before at UNM Hospital. I think it's a great choice because you can send us a link that we can embed in our website, and whatever you're updating there will automatically get updated on all the other websites. So I think that's a great, I love Tableau, and it's really great for dashboards. So just, and it can, you can actually set it up where it'll automatically subtract and do that for you. And, so that we can see, okay, this was awarded, we've paid out this much, this is how much is remaining of those dollars to that entity that we awarded it to.
Madam Chair, Councilor Rogers, we're certainly amenable to those suggestions.
Thank you. And one more question, just in the meantime, where will these reports live online for folks who want to see them in the meantime, like these updates that we're getting? Where does public find those online?
Madam Chair, Councilor Rogers, for the county, it will be on burnco.gov under behavioral health. I can't speak for where APS or the city is going to post their dashboards.
Well, you're saying for future, but she's saying in the meantime, is there somewhere, and I think right now, I was wondering about this ourselves, so like our commission stuff is online and anyone can find it. I don't think the things for this meeting have been, maybe I'm wrong, Javier, if you know. Yeah, if we, like for the meantime, I think even like whatever we received tonight should be public and maybe on this meeting's site, which I don't think has been happening because I've looked recently. But that is a good next follow-up.
That's on, I know.
Madam Chair, this is Julie, Chief Operating Officer for Bernalillo County. So any materials that were not provided in the packet at publication by Monday will be in the after action report, and then we can also get them uploaded to the LGCC site at burnco.gov, and then they will also be on our agenda site as well.
Thank you, Madam Chair. I just want to make sure the city's doing the same on our side, that everything's, I think we need to be coordinated and making sure at least, or if we need to have an opioid settlement just blank, like regular page everybody can link to. But it's going to be hard to keep everything updated across all 3 entities if we're not coordinating that in a way that public can find it. So I would just think everybody should have a page for opioid settlement dollars that everything lives on, and we can link to all of these things so that public can find it for transparency. And then also, even us as teammates, I looked back at the last report that did have, to Commissioner Olivas' question about the city's progress, our last report did include the cities. So things like that we can refer back to if we need it.
So I just want to make sure I understand, because I also, so that this is clear, because I think I heard that December will have the beginnings of a dashboard. Was that true, Dr. Lindstrom?
For financial reporting, and I've just been told that has basically been built and that we do have some data available.
Okay, but in December, that'll be launched, the public dashboard.
The public dashboard on the financial side will
financial.
be, but not on the other performance metrics.
Okay, so, so if that, I think our efforts to make, so that will be available December. I don't want us to create a whole nother website that then we'll have to track people to. I'm worried about that, but this LGCC meeting where hopefully if people are tracking it, it sounds like we do have that. We'll make sure it's connected to LGCC. And I think I've seen on the city's website before, maybe, and I see other people's hands raised, that there is also a LGCC component on this. So if we could just make sure until December, when the other one is launched, that we do that.
Madam Chair, if I may.
Thank you. Go ahead, Sam Single, CAO.
Thank you. The City of Albuquerque website, City Council has a page for LGCC. It has the agenda and the items can be hot linked there. So we can absolutely ensure that our website gets updated and tracking the same information that is on the Bernalillo County LGCC pages as well. So we can make sure on the back end that we can do those things to coordinate. If I may, I'd like to make sure on the report that was done, thank you, Dr. Lindstrom and team for that. There are one on page 3 of that PowerPoint. It indicates the city issued an RFP. We actually issued a grant application, and that was really important for us to do it in that way. So we appreciate if that grant on that portion where it says that it closes on 10/20, it was a grant application process that we actually published, I think about 3 months ago was when that opened. So there has been about 3 months of time for folks to respond to the city's grant application.
Our slides are different than the ones that I sent. But yes, I think that is the same slide that Commissioner Baco is asking to be updated. So yes, I think that can be updated, and that'll be the one that we get on the public website. Thank you. It's funny because that very slide, when I was looking at it, I was like, oh, look at all we did in a pretty place. It just needs to be updated perfectly, but yes, it looks good. Thank you. Was there anything else, CAO Single?
No, thank you, Madam Chair.
Thank you. Councilor Grout.
Thank you. My questions were answered, so thank you.
Oh, great. Great to see you. Thank you. Yes, Vice Chair Jackson. Thank you.
I just wanted to follow up real quick on a question that Commissioner Olivas asked. You were asking about an update from APS, and my question is do you want an update on where, just kind of like a status update? Is that what you're asking for? And then second to that, would you just want an update that could be sent to the LGCC committee members, or do you want it to be placed on like an agenda for our upcoming meeting?
Thank you, Madam Chair. Madam Vice Chair, I either way, I think it's up to the will of the commission, I guess, but just getting a little check-in on kind of how the hiring is going and, you know, the establishment of those middle school counseling positions and all that, so, or
Okay.
maybe I will be hearing about that shortly.
Well, sorry, Madam Chair.
Yeah.
Probably not, because they are in a different bucket of APS. So so maybe what we can do is I can work on a status update. We can send it out to the commission, and then maybe if there are questions in the interim, we can add it to the upcoming agenda for more direct status updates. Does that sound amenable to the group? Yes, okay, so I will do that. And then just the second follow-up that I wrote down, I will make sure that I have a conversation, and CAO Jed, if you can remind me of this, to have a conversation with our data team to determine where that is living for right now until it gets up onto the site. Okay.
Perfect.
Thank you.
And I think that's just my follow-up question. I think that's what I want to make sure I'm understanding now. But that, yes, eventually, maybe once December hits and we have it public, that's our commitment. I'm just reminding us all, including myself, our commitment was that all of our city, county, and APS would be a part of this dashboard with all of our data. That's the way we're all understanding it. Okay. Councilor Rogers.
Thank you, Madam Chair. I think we have the opioid settlement updates on our agenda as just a standing item every time we meet. Is that correct?
Yes.
Okay. So I think every organization, APS, city, county, should be prepared to give an update as a standing item at every meeting. And that way we're just all getting regular updates from every entity and just keep it clean, and everybody understands that that's when the update should be done. It's a standing item on our agenda. So every entity should prepare to do their updates when it's already on our agenda.
Thank you, Councilor Rogers. And I'll ask our very capable staff also to give little reminders or whatever. Thank you. I had a question. Any other question? I just want to thank you for this presentation. This is such great information. I love seeing it all together. I wanted to ask you too, as part of, and I just wanted to also be super clear, and I think Ellen Braden was hazed onto the committee recently, but that it is sort of housed under Bernalillo County and with Dr. Lindstrom as oversight, but we have this really robust board. Can you all explain, and not, I know you maybe weren't prepared for this, but just the variety. I want people to understand both that it's not just Bernalillo County people on this board that are making decisions. And then I would love to hear from you how so far, being members of the board, chair and vice chair, how that's been, just how your experiences have been on that.
We've been talking about this in our last couple of meetings because there was a vote for remaining as chair and vice chair. And so we were just talking about what it's been like. And personally, for me, it's been very interesting and different because normally in my role at Disability Rights, I'm usually dealing with people receiving services on the ground, and usually when they're having a problem with those services. And I'm very rarely in the designing of the services. And so I feel like I'm often trying to just stay at pace with everybody else in the, in the meeting who seem like they know, who seem very knowledgeable, but also just very committed and passionate about behavioral health, which is the thing that keeps me going and feeling like it's worthwhile, because I feel like everybody on that board is very committed to these services and making them work, and I'm excited to see where that goes. And I thank the commission for putting so much thought and work into behavioral health services for our county.
Thank you.
Yes, and so thank you, Madam Chair, and everybody. Yeah, it is a great opportunity just to piggyback off of what Madam Chair Holly was saying. You know, like I also find myself trying to keep up with things at times because it's just a lot of work and development, and there's so many strong people with so many gifted talents that are on the board, and they're involved in so many different things, you know, and me being able to represent peer support workers is a huge opportunity because I would never imagine that I would have this chance. So I'm truly, truly grateful to be a part of this and the development of all this and just learning and just meeting everybody. And, you know, it's not just Bernalillo County representatives, it's representatives from all behavioral health fields, like peer support and disability rights and first responders. And so, yeah, it's a wide array of a great board that just has a lot of talent to bring to this development. So it's a great opportunity. Thank you so much.
Thank you. Thank you both for sharing. And I think please don't let that hold you back, because that's the point, right? Is that everybody brings their strengths and yours doesn't have to be the strengths as others.
Yeah.
So thank you so much and thank you for doing all this work and for your service.
Thank you.
Thank you.
Yes, sir. Thank you.
Thanks for coming to a late meeting. Okay, any other questions about the updates? We're good? Okay, great. We will move, I skipped on some items. Sorry, I'm not doing good chairpersonship. I have to go back and get us to approve the minutes. So moving back to item number 3, approval of the minutes. I move to approve the minutes of the June 26, 2025 LGCC meeting. Can I
Second.
please? Thank you. All in favor of approving the minutes, please affirm. We need to do a roll call. Javier, could you please do a roll call?
Chair Barboa,
Yes.
Vice Chair Jackson,
Yes.
Member Rogers,
Yes?
Member Barbabaca,
Yes.
Member Tammy Feeblecorn,
Yes.
Member Champagne,
Yes.
Member Grout,
Yes?
Member Sengel,
Yes.
Member Olivas.
Yes.
Okay, great. That passes on unanimous vote. And so item 3B, minutes of the August 2021 LGCC meeting, I move to approve.
Second.
Thank you, Member Feeblecorn. Javier, please call the roll again.
Chair Barboa,
Yes.
Vice Chair Jackson,
Yes.
Member Rogers,
Yes.
Member Feeblecorn,
Yes.
Member Champagne,
Yes.
Member Grout,
Yes.
Member Sengel,
Yes.
Member Olivas,
Yes.
Member Baca.
Yes.
Thank you, that passes. Moving on to now, back to 5, new business B, and Dr. Lindstrom will be sharing a presentation on Senate Bill 3. Dr. Lindstrom and Dr. Browen Nasser to present.
Oh, thank you, Madam Chair. I think I'm going solo on this one, actually.
Oh, okay.
Oh, you want to join me? I don't have to. You can.
Well, we'd like to meet you at least.
This is Dr. Bronwyn Neeser, and she's been under contract with us for a number of projects. We initially did a case statement advocating for a number of things related to Senate Bill 3, which we can go into. She's finalizing a diversion plan. We were particularly concerned about House Bill 8 and its implications with changes in competency and what the potential implications would be for increasing the occupancy at the Metropolitan Detention Center. And that document's also going to serve as a basis relative to some of the expectations in SB 3 for adults. And we'll elaborate on that some more as well.
Great.
It's not represented on the slide deck, but I'd just like to give a bit of context for SB 3. In the last legislative session, there was a package of bills that began with Senate Bill 1, which was a $1 billion trust fund for behavioral health. And unfortunately, by the time the session ended, rather than $1 billion being committed to that fund, $250 million was committed. So whenever I have a chance to address whatever audience, I want to point that out because I want us all to be able to advocate with the legislature that they hold true to that original commitment and make additional investments in that account. It was projected at the time that if we had the full $1 billion in the investment trust, by the end of year 3, it would produce a dividend around $50 million annually in new money devoted to investing in behavioral health. Senate Bill 2 was a gap funding measure. As I mentioned, it was expected that the investment trust would yield a dividend by the end of year 3. So the legislature thought that there are needs that need to be met now. So rather than having to wait 3 years, they created about a $160 million fund for funding through those three-year period. And that measure in and of itself didn't pass on the floor, but instead what happened is that money was rolled into House Bill 2, the budget bill. So that money is in fact appropriated. And then Senate Bill 3 had to do with creating a regional planning mechanism that would cross over between the intersectionality of behavioral health and criminal justice and create an expectation under the administrator of the courts that there would be regional plans developed in each region. The composition of the regions was not spelled out in the original legislation. This was later determined by the executive committee under the Reform and Behavioral Health Investment Act. And one of our positions in our original case statement was for the alignment of these regions aligned with the judicial districts. And here in Bernalillo County, 2nd Judicial District is our district, and we wanted an alignment so that we could do planning rather than what has happened historically. Oftentimes there's a new statute that creates some kind of new regional structure, and as those are piled up over successive sessions, we end up having planning boundaries that don't coincide. That really adds another level of complexity around doing coordinated, integrated planning, funding, et cetera. With that, we'll talk about SB 3. You want to start with that?
I can.
Sure, thank you.
Madam Chair and Commissioners, thank you for having me, although a surprise. So the executive committee was formed. It consists of Nick Bucas, who's the director of the Behavioral Health Services Division at HCA, Carrie Armijo, who is the cabinet secretary of the Healthcare Authority, Dana Flannery, who's the medical director of the Healthcare Authority, Carl Reifstack. Medicaid director, I apologize. Carl Reifstack, who's the director of the administrative offices of the courts, and then 3 behavioral health experts, Dr. Violet Cloud, Dr. Stacy Cox, and previous Senator Jerry Ortiz-Pino. That committee was created to oversee and to sort of, as Dr. Lindstrom likes to say, build the plane while they are flying it. They've had 3 executive committee meetings thus far, and at each meeting we've learned a little bit more about the expectations of what they would like to see from the full regional plan.
Would you take the next
one? One of the important things to note about regional planning is that the executive committee is requesting that this be a lifespan approach. So at the end of all of this, they want us to have both children, youth, and family priorities as well as adult priorities. I think what's important is to reflect back on what Dr. Lindstrom said about the funding opportunities and the funding that was put forth by the legislature and the funding that's now available for SB3. No funding is available unless you have an approved regional plan, and those regional plans, like I said, have to include the lifespan. The funding is spread out, so it got a little exciting in HB 2 is where we see all of the funding priorities. So there's a slide that provides a sort of an overview, but as you can see, all of this is kind of sparsed out in terms of what they would like to see done with that money. So crisis triage centers, outpatient medication, community treatment diversion, care management, equipment, mobile crisis response, recovery and outreach, mobile crisis recovery response, diversion, crisis intervention and response, obviously technical, so IT updates, et cetera, closed loop referral systems, which Bernalillo County is now looking at, as well as the state, identified regional funding priorities, and evaluation, audit and evaluation requirements. And that's sparsed out between a lot of different areas.
Can I ask real quick, just that we're looking at the same, are we looking at what you're looking at?
Yes.
Okay.
Yep.
Oh, I do see. Go ahead, sorry.
Yes. I'm trying to keep it condensed because this, like I said, it's kind of all over the place in terms of who holds the money. But for regional planning in general, the Healthcare Authority is overseeing the funding and the funding structure. That hasn't been determined yet. We're hoping to hear more about that at our next executive meeting. There's supposedly going to be a presentation on that, although at this point, I don't hold anyone to some of those larger tasks. We're kind of just rolling with the punches as they come. But as you can see, there's a lot of money available for a lot of different projects. However, when you actually look at 13 different judicial districts, that money kind of dwindles down into what's actually available. And again, all of that has to be attached to a approved regional plan.
This is statewide, correct?
That's correct. Yep. So we're also on some pretty tight timelines. On September 30th, the administrative offices of the courts offered a mini grant to fund this application or the regional planning process. The regional planning process consists of some pretty large asks. They would like to see at least a minimum of one large community listening session. We need to host an enhanced sequential intercept mapping event. We also need to sort of actually write the plan, but get that plan approved by all of the members of our community. So that 9:30 deadline we met. We submitted our application on September 23rd. We were the first to have tribal support in our area, so Isleta is also going to be partnering with us in our regional planning.
And we still have some meetings pending with the others.
Yes, and we still have meetings pending with Sandia and with the Tohajili. Once we do our eSIM event, we have 45 days from when we receive the report from that event. So UNMH is the technical assistant. They are running that event. They then will provide us with an entire report that comes out with all of the different gaps and needs that we've addressed in that eSIM, and then some ideas of where the priorities laid in terms of voting that happens at those events, at that event. So 45 days from then, we have to have a draft. So not a full, complete report, but just a draft to submit to the administrative offices of the courts to make sure that we're on the right track. Does this look appropriate? Is it what you expected? Just so that when we get it to the executive committee, we're not looking at major edits or anything like that. The overall plan is due by June 30th, and that's to the executive committee for approval for FY27 funding.
Thank you.
Can I ask real quick if you could explain to me a little bit more eSIM, and if UNM is running it, do they have a date ready for the event? This 45 days after eSIM event?
Yes, Madam Chair. We actually have our first, so we weren't allowed to start planning until we had an intergovernmental agreement set with the administrative offices of courts. That came out of our September 30th application. We have since received that and are in the process of.
Receiving $60,000.
Yes, we are. Did you sign it? Did you sign the IGA?
We have not signed the IGA.
Okay, so we're in the process of signing the IGA. When that gets signed, we'll receive $60,000 for planning. That's a part of the grant portion of it, but it also allows us to actually start planning. We have our first planning meeting scheduled with AOC and UNM, sort of as a jump start in good faith that intergovernmental agreement will be signed on the 20th, I believe, of this month. And then I think our expectations are that we would do the eSIM as soon as we possibly can to get that underway.
Explain what eSIM is.
Yes, thank you.
Yes. So sequential intercept mapping is a SAMHSA model for better understanding gaps and needs at 5 intercepts. So it goes from intercept 0, which is their understanding of sort of pre-justice involvement, so at a 988 call or at an emergency room or sort of like a first crisis situation, but we're not involved with the justice system or any type of law enforcement. Intercept 1 is law enforcement involvement. Intercept 2 through 4 is really within the legal system, so the different aspects of being a part of the legal system. 4 being within incarceration and within a detention center. And then intercept 5 is that reentry point. And so where do we have reentry? And basically the enhanced portion of that is more of a focus on early prevention. And so we've added sort of another layer to that prior to intercept 0, which is what are we doing in the community and what are we doing for early prevention? Because we are taking more of that lifespan approach. And so that was added in, that's where the E comes from. But SIM has been around for a very long time, SAMHSA has been running it. We've completed one here in Bernalillo County for adults in 2019.
Yeah, we've done 7 total.
We've done 7.
Over the years.
And so we're excited to really take the opportunity for our eSIM to really focus on children, youth, and families, since we do have this rather a plethora of information regarding our adult system. We haven't really looked at our children, youth, and family system in such an intense and I think meaningful way. And so this is really an opportunity for everyone to kind of come together and really see what the city of Albuquerque and Bernalillo County have for that population. That will be a 2-day event. The first day is really set around the intercepts and pulling in stakeholders, community members, people with lived experience to really speak to all of those intercepts, what's happening there, what's working, what needs to be better. And then day 2 is really a focus on what are the priorities that we want to see, what are things that we really want to focus on, and how do we manage to come out with strong goals that are achievable. And so that's 2 days that we're looking at.
I absolutely love that, and I just want to ask real quick, because each region will be required to do this across the state, this is what you're talking about is for our region, which includes Bernalillo County and just Bernalillo County?
Madam Chair, just Bernalillo County.
Okay, great. Yes,
if I might, there are a couple of other things I would like to include that are recent developments. There was an announcement at the last executive committee associated with the Behavioral Health Reform and Investment Act Executive Committee that they call early access opportunities for funding, and that they originally announced that it would include up to $2 million for each region to potentially fund proposals within 4 categories. One of them was housing, including transitional living. One was crisis response. One was medication-assisted treatment. And the other was prenatal and perinatal services for mom with substance use disorders. So there was a lot of public comment at that executive committee meeting and advocacy around changing the formula for distribution from each county getting $2 million to potentially doing a per capita distribution. If that change is adopted at the next executive committee, we would be qualifying for a significantly larger amount. And so we will be introducing a measure to the commission relative to, regardless of what the amount is, that when we receive that announcement, that it gives the county manager the authority to do the appropriate funding and implementation relative to whatever the amount is. Oh, yes, and the categories may change as well. I want to point out, too, that you heard Dr. Neeser talk about sequential intercept model, but this is a model that was only developed for adults and the criminal justice system. And this is all about the intersectionality between behavioral health and criminal justice, and it's never been applied before to youth. So the administrator of the courts has been very open to modifying that model, and we've been selected as the pilot site to work for the Consortium for Behavioral Health Training and Research at UNM that's got the technical assistance contract to do this planning statewide. And with us as a pilot, focusing exclusively on children, youth, and families, this will be a learning opportunity for UNM as well, so that they're better positioned to learn from their experience with this pilot, that they can be in a better position relative to technical assistance to all the other regions when our project's completed.
Wonderful.
Madam Chair?
Yes, Commissioner Olivas.
I wanted to ask a question about the we in this. You keep mentioning we, and I think this is more than Bernalillo County, but I might be wrong. Can you just explain who is involved in this effort?
There are requirements in the statute that the we is about as broad as the expectations the commission had in forming the Behavioral Health Authority Division. So this is supposed to have broad stakeholder involvement, including our indigenous communities, but the regions, as I said earlier, align with the judicial district. So the boundaries of this regional planning are Bernalillo County. And when we submitted our application to the administrator of the courts, we asked for letters of support from the city, recognizing the county as the lead entity under this opportunity, so that we would be leading the planning and corralling all the stakeholder involvement that's expected from the statute itself. And we also had a letter of support from Isleta, and we're hoping to get them from our other indigenous partners as well. So this will be a collaborative effort, and we also received approval that our Behavioral Health Advisory Board, since it has broad stakeholder engagement as well, would be the primary advisory board relative to this opportunity. We had initial conversations with the Criminal Justice Coordinating Committee about their level of involvement in partnering with us, and they made it very clear that they do not take policy positions, but they did agree to provide review and comment. So that will be one of the first bodies once the Behavioral Health Advisory Board has reviewed the plan and the recommendations that come out of it. It would go then to the Criminal Justice Coordinating Council. From there, it will go to the Health Equity Alliance, which is our public health council in Bernalillo County. And we will be seeking other inputs as well. Ultimately, the requirement is that we come up with 5 key recommendations. And when those are submitted and approved, then we have the ability to apply for these different allocations within HB2, the funding that was just delineated until we're at the point where the trust fund is producing a dividend, and we will apply via that mechanism. I might also point out that originally when this was crafted, all the authority for this entire initiative was placed in the administrator of the courts. During the session and committee hearings, there were a lot of concerns that, number one, that there are a lot of folks who have behavioral health issues and that are not involved in the criminal justice system, and that they should not be excluded. So the expectations is that we look at overall behavioral health needs, in this case, within the county. In addition to that, there was concerns about whether or not the administrator of the courts had the capacity and infrastructure to manage these kinds of dollars, and what limited expertise did they really have in behavioral health. It was another issue. So a compromise was reached that the AOC would handle the planning and the healthcare authority would manage the financing.
Wonderful, thank you.
Thank you. I think that answered my question, but it sounds like that's still in formation very much as far as kind of who are going to be. I mean, everyone is a stakeholder in a way, every entity, every group, and then, you know, some may be more actively involved, others maybe less so, just depending on their level of interest or ability to participate. But it does sound like it is coordinated. You've got the city involved, you've got tribal. You're saying that we're focusing on children, youth, and families. So are we also including our APS partners or other sort of, okay. Yeah, very good. I think that answers my question. Thank you.
Thank you. Any other questions? Yes, Councillor Rogers.
Thank you, Madam Chair. I just have a question, is how the funding for this flows through the county for behavioral health. How does the city access behavioral health dollars of the county for programs we run for behavioral health?
Again, going back to the airplane and flying it analogy, we keep being told the guidelines are under development. And so we've been told there will be application templates and other tools available. And given that we are designated as the governing entity, if you will, I don't know if that means that we have to apply directly and then sub-award, or whether that means there's opportunities. So if the city has expertise that the county doesn't have and a substantiated need in the planning, et cetera, that they can plan directly. But quite frankly, I don't have the answer to that question, Madam Chair and Councilor Rogers.
And I just want, oh, go ahead, Councilor Rogers.
Thank you, Madam Chair. I just would love to follow that and figure out, because I mean, I think that's often something I think that's a barrier for us is accessing that funding. And then my other question is, how do the local councils fit into this bigger regional work? I was assigned to the LC2 for behavioral health recently. My first year in city council, I didn't get assigned this year, but I know that there was frustration around those local councils for behavioral health that that they weren't engaged or really through the whole pipeline all the way up to the state included in any of these conversations. So how do the LCs fit into these?
Madam Chair, Councilor Rogers, we had a similar presentation just a couple of weeks ago with Local Collaborative 2. I might point out to members of the LGCC that the local collaboratives were formed when the original Behavioral Health Collaborative Act was passed at the state. The promise of the Behavioral Health Collaborative was never realized. At that time, there was something like, I'm trying to remember, I used to be CEO of the Behavioral Health Collaborative, but there was just about every department of state government had something to do with behavioral health. They were supposed to bring their respective budget dollars that had to do with behavioral health to the table and do joint planning and do bundled funding. the most that any State Department brought to the table were 5 departments. And then that dwindled till 3. And some administrations were not supportive of the Behavioral Health Collaborative, which called for quarterly meetings of the collaborative. And once the CEO of the Behavioral Health Collaborative, who succeeded me when I was in that role, was not replaced, and the collaborative wasn't convening, the legislature said we need something better, and this hasn't worked. And that was a major impetus for moving forward with this Investment Act. And the reason I'm going down this road with you is because the local collaboratives in the beginning were each had received annual allocations to do more local planning relative to behavioral health. Eventually, those monies weren't available, and one by one, local collaboratives shut down across the state. The collaborative in Doña Ana County and the collaborative here are a couple of the exceptions to that. And even though the collaborative's been dissolved, the local collaborative has been reinvigorated, and I think been looking at more diverse resources, et cetera. And so, as I said, we've met with them and told them about partnering with us relative to this initiative.
That's great to hear. Thank you, Madam Chair. I think that's just really important. They still want to be engaged. They still are sticking around and really feel like the redheaded stepchild. And these are local folks on the ground doing the work that should feel their expertise should be respected and utilized. So thank you for that.
Thank you. And I just want to clarify a little bit what I think, because I also heard, right, that so right now these regions are being formed. It was just barely passed. So if we are actually in a more advantageous place because of the work of this body, and because of the work of forming the Behavioral Health Commission that has a robust team that we just heard of from different sectors, we are way ahead of most other counties because they have to form the demand was to form a diverse cross-sector commission, which yay we have. The demand was to think about what those have some stakeholder meetings, and like she said, start a regional plan. Because we have a strategic plan, we have those things in place. So it sounds like I know that we're ahead of the game. And just to Councilor Rogers' point, there isn't been that funding hasn't come to fruition yet. So it sounds like the state is still deciding how that would be distributed, and even whether it be just this blanket, each county gets 2 million, or if they're going to do per capita. So that hasn't been decided yet. But again, it's the region of the county, and I think we're fortunate to be in a place where we already have collaboration set with the city, APS, and UNMH. And so how we move that forward and make sure that it's available to those that need it, or how we can influence that process at the state level. But that's happening at the state level. So I just want to say, I don't think there's been a point where there's been dollars available that haven't been transparent to everybody at the table, I guess. And I think that's true. Yeah. Yes. I can't see who, so Javier, if you could tell me who has their hands raised or show them. Okay. Oh, wait, might have lost Counselor Rogers. Maybe she fell off. Hopefully she'll come back on. Yeah, hopefully she'll come back on. Any other questions, comments? Well, I guess I just want to say thank you. I think there's lots of exciting opportunities. I think we're in a great position, and hopefully, and I guess last to say, I know Councilor Rogers isn't on, but I'm really glad, and I agree that the local collaboratives are super important, and they just have, they're just they've gotten a little bit of investment finally, and they're able to come back together again. But I think that's going to take some time to get themselves together. Okay, there's not. Thank you so much for this update. Great to meet you, Dr. Nesser.
Thank you for the opportunity.
Thank you, Dr. Lindstrom. Okay. Wonderful. Moving on to 5C, under new business, the Academies of Albuquerque. Thank you, APS leadership, for being here in person today. Welcome.
Madam Chair.
Yes, Ms. Jackson.
While they're getting prepared, just because they weren't listed, I just want to introduce them.
Please do.
If that's all right. So we have Chief Academic Officer Sherry Jett. We have Deputy Superintendent of High Schools Marco Harris. And, oh, there it is. We have the APS Director of CTE and the Academies of Albuquerque presenting. So,
thank you. Thank you all for joining us. Thank you, Vice Chair Jackson.
Well, good evening, Madam Chair and members of the LGCC. I am Sherry Jett, Chief Academic Officer for Albuquerque Public Schools, and it's always our honor to come and talk about our work, so thank you for having us. This evening, we really wanted to introduce you to some of the work we're doing around how we're re-envisioning the public education experience in APS. And this vision is very much about a community-connected collaboration in which we're all coming together to really build a better, brighter future for our city, our county, and of course, our state as well. As a result of House Bill 171, which was passed 2 years ago, in our state legislature, one of the requirements was that as a district, we revisit our profile of a graduate. So what you see before you is our APS revamped profile, and this is really part of our core commitment. From pre-K to 12, these are the defining characteristics of not only the students that we're going to graduate, but the daily experience that our students have in our schools. And so just really thinking about what are the mindsets, what are the skills, habits that go with that, and how do we embed that into our academics and our curriculum. In order to achieve this, we're really looking at three big areas to redesign. And the first thing is teams of distributed expertise across systems. And what we really mean by that is we have a lot of expertise in our city and in our county and in our state, and it's not all necessarily educational in nature. We know through a community-connected approach that we can bring more opportunity, more access, more networks to our students. And our goal here is to really keep our students here in our city and keep them from going out and about to find other jobs so that we can really begin to drive our economic success here in New Mexico. The second area that we're really digging into is deeper and personalized learning experiences. So at the heart of this is a lot of inquiry and how we develop opportunities for students, not necessarily to sit in a passive manner. So if you've seen any movies lately about what high school looks like, kind of looks the same as when I was in high school, or maybe even some other people in the room. And so we don't want that to be our future experience for our graduates. We want them to be in the community. We want them to be doing hands-on learning, doing things that reflect their interests, their choice, and their voice. And then finally, the college and career readiness. And this is really, I think, at the heart of what we wanted to speak to you about tonight. And this is our initiative of the Academies of Albuquerque. And in a moment, I'm going to hand it off to my colleague, Marco Harris, who is our Assistant Superintendent for High Schools, to talk a little bit more in depth about it. But the one thing I really want to highlight before I do that is that this is the Academies of Albuquerque. It's not the APS Academies. And so this really is a community-connected approach. And we really are leaning into how can we collaborate with our industry, with our business leaders, and our community leaders in order to create these opportunities for our students. Thank you.
Thank you, CEO Jett. So I think what should I get closer?
No, you're good. Everybody that's tall does that, but we can hear you, I promise.
So I think what I really would like you to remember from the first portion of this presentation is the idea that we're truly internally and externally trying to build capacity across the board. And so obviously, as Albuquerque Public Schools, there are some structures within APS that we need to really hone in on to develop those deeper personalized relationships, as well as garnering and honoring inquiry-based learning. And so as you look at this graph here, I think that really accentuates what CAO Jet has stated, which is the profile of the graduate is really our foundation. I have a problem with the airplane flying in the air because it's a glider. It's not something that is ever going to get guts. And so I think sometimes when we use that analogy, we kind of lose the scope of. So I'm going to use the idea of a house or building a foundation, AKA the profile of a graduate, because once you get the frame up and maybe a roof on, you can stay in that home or that space as you start building out the floors in other areas. I would love for you to kind of conceptualize that idea as I talk through this framework. So when we talk about the elementary schools, we're really looking at the exposure. How can we bring career, how can we bring industry to young people that like to pick their nose and have a hard time staying clean, right? Well, if you have a hard time staying clean, why not become a construction worker? How can we expose? Or why not be a doctor or a surgeon and get real messy, right, in those? So how do we expose young people to really start thinking about not who they want to be or what they want to be, but just giving them a sense of who they are in that moment. Moving into then the idea of middle schools, we start really exploring what the opportunities for career and industry can be, or even college. And so those exploratory opportunities, right, is bringing in those businesses, bringing in those schools, bringing in those opportunities for young people to see themselves now. Start defining, how do I want to get there, or what do I want to be? As a longtime middle school principal, right, it's really difficult for the middle school kiddo to see themselves tomorrow because it's a stranger. And so the more that we can fill those holes with non-strange things that I am capable of doing, then I think there's more opportunity as we move in from the middle to high school into that freshman academy. And that's what I want you all to kind of focus in on now, is the transition between middle and high school. We're looking at building out freshman academies, or excuse me, we have built out freshman academies in at least 3 of our trailblazing schools. That'd be Manzano. I got to share the workers because we are a collaborative effort and body. Is Manzano High School, Highland High School, and Cibola High School have all embarked on wanting to be not only trailblazers, but individuals who are really focused on, right, providing a different experience for young people as they navigate through their schools. And so that's where I think we can do the job. How can you help county, city, APS is providing spaces for young people to go and see themselves. So maybe job shadowing. Maybe somebody would want to be a commissioner, city councilor, God forbid. No, I'm kidding. But the idea of providing and shadowing, interning, and giving that other experience, as CAO Jet said, many of us going through the traditional high school, it was AP Calc, failed, social studies, US history, okay, A+, right? And not very connected to what I'm gonna do after life. So that's where we move into the academies, as we have in the freshman academy developed young people, those durable skills, who do I want to be, what am I really thinking I want to be after school, is where the academies kick in. And I should let actually Shelley talk about this. But ideally, most of you know that there are career clusters that the state of New Mexico, as well as nationally, that are identified. And within those career clusters, we would develop pathways. And that's where we're in the internal building of currently, is really trying to identify, next slide, these large global academies, and then what would be the coursework, or what are the pathways in which we can create to ensure that our young people have the experience in which they deserve as they navigate pre-K-12 through Albuquerque Public Schools. So when you look at this slide, what I'd love for you to really hone in on is there's actually over 13 different career cluster opportunities within this slide, as you only see 6. But the idea of business, marketing, hospitality, and internship, those are 3 different potential career pathways that a student could follow within that academy model. So with that, I think, So with that, I am going to turn it over to Shelley because I will continue to keep talking unless you want me to. No, okay, I'll keep talking. All right, I'll talk. I'll keep talking. So let's take the business marketing or public service. Which one do we use?
This one is hospitality.
So let's use number 2, the hospitality and entrepreneurship. So this would be a developed out career pathway or program of study. And what you see is this is the base, what we used to call culinary arts, which now we are trying to retrain everybody into the ProStart terminology. And as you can see, what creates a career pathway is actually that little blue box at the end that says completer. Once you have a completer pathway, which is 3 sequential courses, that then gives you an opportunity to achieve whatever you achieve in the next step of moving towards that career or moving towards that college opportunity. So that's just one example at Cibola. Here's another example at Manzano. I know that you have these on your desktop to look at. And so the end of this is really what we are attempting to do within Albuquerque Public Schools is really shift our instructional practice. If you look at the left, we look at interdisciplinary instruction. It is something our elementary staff do amazingly. The middle school philosophy is built around interdisciplinary planning, and we need to move that into high schools. That will start at the freshman academy, and then obviously 10 through 12, jump into those career pathway opportunities. Right, the key word there is teams. We can't do this in isolation, and we got to ensure that all stakeholders are involved. I am proud to say that actually on October 28th, we will be hosting a convening with multiple partners, the United Way, I just had the Ford NGL, which is Ford Next Generation Learning. And we will be bringing in community partners that are identified through the United Way and other stakeholder groups to start talking about what this looks like to establish tactic teams. And those tactic teams will very specifically address barriers potentially or exciting opportunities that our students will embark upon, which gives us the deeper learning connecting to real world relevance. And with that, I will open it for questions.
Wonderful. Thank you so much. Do my colleagues have any questions? No, I'm just looking online or in person. Okay, y'all know I do, so.
I did not really a question, just a comment. I'm very excited about the philosophy that you're presenting there. You know, I think that really aligns well with what we're seeing in the workforce and trying to keep kids more engaged and feeling like there's really a pathway for them and something they can get passionate about, you know, rather than pushing everybody into, you know, you must go to college, and even if you don't know what you're doing. And, you know, I was one of those people that changed my major like 5 or 6 times before I actually landed on what I got my degree in, and now I'm not doing anything to do with my degree.
Exactly.
So I think this is really a nice way to honor the fact that we live in a very diverse community and job opportunities. And frankly, it doesn't have to always be in the sense of a job even, right? We know that people can find meaning in life without working, whether that's through parenting, whether that's through military service, volunteer service, their job, whatever they're doing. And so I think this really respects that kind of reality of our society today. And I'm very excited to see that happening, and glad to see it's happening at Manzano. That's a school in my district, and my mom graduated from there. So always happy to see good things happening up there. And thank you for your work.
Thank you. I see CAO Sengel, please.
Thank you, Madam Chair. I am disappointed I wasn't there tonight to have the opportunity to hear the presentation in person, because I'm just incredibly impressed with the work that APS is doing for creating environments of relevant learning in the high school environment. Having 5 children that have gone through APS and recognizing how important and valuable it was to have those experiences where they learned about careers and learned about skills that put people in a position to understand how those skills relate to the rest of their lives is really valuable. I just wanted to mention that one of the really special things about both of our governments is that We actually have incredible opportunities for supporting the academies. Mayor Keller and the administration, we've already had many discussions with APS about how we will lean into the opportunity to provide those learning experiences for kids of any age that APS is looking for the engagement. As you think about both city and county government, we have, everything from veterinarians to accountants to mechanics to drivers, and the list goes on, marketing, all of those different skill sets and cluster focus areas. We actually have the ability and opportunity to provide an abundance of those placements and those experiences, whether that's job shadowing, internships, externships, any of that that may work for APS in building out the academies. So one, thank you, APS, for your movement in this direction and really thinking about experiential learning. Obviously, from my history, I have quite a bit of passion in this space, and I think this is just going to be transformational for kids. And two, I would like just to thank all of our public partners here, because I think we will be able to be in a position to really forge the pathways for kids to have these experiences. And what a great environment for them to learn in terms of, serving community, and the public and government is actually a great pathway. But these career paths that I'm speaking of really don't have anything to do with it being about us being public entities, because we have the diversity of workforce. So thank you all for your presentation.
Thank you, CAO. And of course, I do have to ask some tough questions. So I do love this model, and I love a future, thinking about a future of for our students in APS that will work. And I'm very fortunate today because I have two people that were part of my children's education. Ms. Sherry Jett was at Health Leadership High School when my daughter attended there, and Marco Harris was the principal at my son's middle school, at Wilson Middle School. So Burke true and I'm true. We're such a small community. But, so part of what I have noticed in my experience with APS and why my daughter was at a charter school, she's the younger, was because that experience oftentimes for what I don't see in this model is like, what are we doing for the kids that are falling through the cracks, or the kids that are system involved, or the kids that are whose families are in a precarious place? How is APS thinking about those students?
Thank you, Madam Chair, and that is a wonderful question, and I'm glad that you asked. So part of the model when it comes to the academies and that we've instituted at Cibola, Highland, and Manzano is that freshman academy. And Assistant Superintendent Harris mentioned the teaming. And so currently within those three schools, they have teams of teachers with the students broken up between those two teams. So all of the students that are freshmen have the same math, science, English, and history teachers. And they meet every week to talk about discipline issues, to talk about this student's been absent, this student is having, a health crisis. And so it's really creating those smaller learning communities where all students feel like they have a supportive adult and where they belong in their high school. And so that is actually one way that we are addressing that problem. I don't know if you guys want to add anything onto it, but that's actually one benefit.
So like right now, I guess we're at this council, right, we're really focused on the substance use, either in the child themselves or their family, and what that often means, and around homelessness or able to do homework. I think it often comes out in attendance, right? And so what is APS? And I ask this because, we were able to, and I know Crossroads is like the beneficiary, but I think APS is the beneficiary of the amount of money that we were able to say was apportioned for APS in this. And I think our hope is that this council, I will speak because we were in a long debate about it, right? But the hope is that that's one of our preventive measures or intervention measures, because we know that like if a kid, we're here all the time, our DA or our law enforcement saying that 11-year-olds are the problem. right? What are we doing about those 11-year-olds when we see that? I don't believe we can incarcerate them. So what is APS doing or could be doing for those intervention and prevention?
Madam Chair, members of the LGCC, thank you for that. And I really appreciate Ms. Kinnanen talking about small learning communities, because when we put students in those small learning communities, then we basically have more adult eyes on them, if you will. And so as we begin to see behaviors that may be troubling or maybe red flagging for substance abuse or mental health crisis, we are able then to activate the resources that we have for intervention. And another system that is within that small learning community that I'd really like to elevate is our student success systems work. And so this work is specifically around pulling data that shows attendance, behavior, and coursework, and then through our board goal number 4, the skills, habits, and mindsets that a student is perceiving that they have. So for example, if we're seeing a student who is absent a lot, then we would assume that probably their course grades are suffering. And then we might look at their information they've given us about perseverance or self-efficacy. And we begin to really learn something about the students. And then from that information, we can design the really sophisticated interventions that then deploy the resources that we have that would be appropriate to that student. So really trying to wrap around them, but also wrap around them before we get to that point.
Wonderful. Wonderful. Thank you. And Nas, I just want to add, so I mean, the amount that we were able to agree on to support APS in this, you know, in the big picture, it's small in things, and I'm sure APS can find a million ways to spend that in a minute. I do think Crossroads is going to build, and they talked about expanding to middle schools. I received a few calls after we took that vote where they're like, Crossroads isn't supported in APS anyways, and what's this? So I'm not just to say, I hope that whatever efforts Crossroads or however APS decides to use those behavioral dollars for intervention and prevention efforts, we want to have the public dashboard, and I hope that they will be supported. Or I mean, I trust you all as educators to figure out what that looks like, but I also just want to say honestly, I've had enough experience with APS really sort of push out youth in that have that experience, right? Youth that are, maybe it's for attendance or whatever, and hopefully we're moving. I really love Gabriella Blakey. I know her. Her father was my principal at Albuquerque High School. So it's very connected, and I hope that, and I believe everybody has the best of intentions for our children. And I've experienced that myself, that APS has been a place that can expel students because for things that, you know, that expulsion and sort of push out of the bad kids, right? And I think that's what we're trying to say. This intervention money isn't enough to save the bad kids, but that kind of effort is supported and valued across APS.
Thank you. We're grateful for the support, and we definitely want to be a place where all students belong, and they are. We do wrap around them, and we do ensure that they're having a very high quality experience and reaching graduation and earning our diploma. Thank you.
Wonderful. Thank you. Yes, Member Jackson.
Thank you. Just to maybe calm some of your concerns, Chair Barboa, I do just want from a board level to explain that APS really is, especially in the past couple of years, been working really hard to do things differently. So if there were past experiences that might have happened, I will say that from a board level, with the board setting the 4 goals for early literacy, math proficiency, post-secondary readiness, which is very much in line with what the Academies of Albuquerque is trying to move towards, but also that goal 4 of skills, habits, and mindsets of life success. This is not only is the Academies of Albuquerque a different way of doing high school, the board goals is a different way of APS doing education. And we don't just set the goals, we've also set the guardrails. And a lot of that is the wraparound supports. And I think with having those in line and having those be very public, and we try to talk about them a lot, I do just want to kind of give you some comfort that those issues that are of concern I think are really being looked at, and the data is being, as Chief Academic Officer Jett was mentioning, we're really starting to look at the data of why is this happening? Why might have a child been pushed out or maybe felt like they didn't belong? And so I think by having that data, by having the accountability from the board to the superintendent, I hope to give you a sense of hope that APS is doing things differently, and that we are making system changes to benefit our youth. So.
Thank you so much, Member Jackson. I do believe that is everybody's intention, and we're all trying hard, so I just want to appreciate that as well. And last, just because I have you, I'm going to also ask that we do a follow-up that I have failed to make happen, but we have Dr. Lindstrom here today, and I'd love to someday follow up that in our, the county's Youth Services Center, or the D-Home, you might know it as, APS runs our education in there. And I would just we've talked about it a few times at this board. I think the county had some things to fix among our stuff. And I think there's also some things that we can address on APS's side in the facility. And I'd just like to follow up about that.
Thank you.
With the appropriate person, of course, which might not be all of you. But thank you very much. If there's no other questions, thank you so much for your time this evening.
Thank you very much.
Yes. Yes, I will. Okay, great. So if there's not any other comments or announcements, wonderful. We will have our next LGCC meeting Thursday, December 8th. Oh, there is one more thing. December 18th. That is how is that date, Phil, for everybody? We can change it. I asked Javier before because just of its closeness to, is there any reason why we would want to change that date? Or I asked ahead of time, we can change it without any problems of meeting any kind of, but we should do that now. Yes, Counselor.
Madam Chair, that is very close to Christmas. I wonder if we could bump it up a week to December 11th.
How do folks feel about that?
During finals?
During finals? Well,
I think I'm not
taking finals, thankfully. Just kidding.
I guess I would move it to December 11th if that is possible.
Okay, is that, I'll second, and then we can discuss if that feels possible to others. Does December 11th feel amenable to others? Anyone online that I'm not seeing? Okay, if no discussion, then Javier, please call the roll for December 11th. This vote is if you agree that we can move the December 18th meeting to December 11th, same time. Same place.
Chair Barboa.
Yes.
Vice Chair Jackson.
Yes.
Member Feeblecorn.
Yes.
Member Champagne.
Yes.
Member Grout.
Yes.
Member Single.
Yes.
Member Baca. Yes. And Member Olivas.
Yes.
Wonderful, thank you very much. Then the next, we'll make sure we get that information out to all members, including those who aren't here. The next meeting will be Thursday, December 11th, 2025, of the Local Government Coordinating Commission, 5 p.m. Ken Sanchez Chambers, and hybrid online option. There is no other business. This meeting is adjourned. Just kidding.
That's it.
Thank you both. Thank y'all three, Alan.